Hi, this is Jay Bhatri, Assistant Professor, MPT in Cardiovascular and Pulmonary. I have been working here for 5 years and 6 months in Faculty of Physiotherapy, Dr.M.G.R. Education Research Institute. So today I'm glad to talk about pulmonary function test. So pulmonary function test is basically a test to find out the lung volumes and capacities in many conditions like chronic bronchitis, asthma, and also for pre-operative and post-operative conditions to find out how is the lung function. So we'll see about the pulmonary function test kit now. So we have 2 kits here in our department, that is in our Faculty of Physiotherapy. We have 2 PFT kits and it costs around nearly 50,000. And we are also proud to tell that in Chennai, our college has this kit for students' learning purpose, and we are very happy about that. And we'll see about the device now. So this device comprises of a cable, a mouthpiece, a turbine, it's a nose clip, and this is a sensor for connecting the cable and the turbine. So now this is the hardware. So this hardware has to be connected to the software. So we have this software in the system already installed, and now we need to connect this so that we can do the test. So we'll see how to connect this. So this portal has to be connected. And the other end of the portal will be connected to the sensor here. And you have a light glowing here when it is on. And this is the turbine. So now it is all set to work. So now we'll see about the software, how to start with that. So this software is a Spiro Excel already installed here, and first we need to enter the patient details. So that is a Spiro Excel already installed. So I'm clicking that, and first thing is we need to enter the patient details. So I'm going to the patient records, I'm clicking add, so that now I can enter the details of the patient. So entering the age, sex, height and weight, and also the date of birth and the smoking habits. All these are mandatory details. So what's your age? Height?
Height 5.5.
You can tell in centimeters.
170.
What's your weight?
Weight 18.
Date of birth?
15/5/2021.
So okay, in these patient details, the height and weight determines the patient's lung volumes and capacities. So after entering the details, I am saving the details. And then we have the patient test in the column, the lower one. So add visit. So in add visit, I have 3 tests. So forced vital capacity, slow vital capacity, and maximum voluntary ventilation. So we will see all these 3 tests one by one. So first one is forced vital capacity. So when I click that, I get a graph here. So this is a spirogram. So now giving instructions to the patient how to perform the test is also very important. So the patient has to do at least 3 tests so that we can take the average or the best result out of that, best reading out of that. So I'm teaching now how to do. So I have connected the mouthpiece, and now the patient has to hold this mouthpiece in his mouth, and he has to put the nose clip. So first do a relaxed breathing, and then do a deep inhalation through the mouth and forceful exhalation through this mouthpiece, and he has to sustain the breathing at least for 6 seconds. So we'll do the test now. First deep you inhale. Put the nose clip. See, first you have to inhale deeply, okay, and then put the nose clip, and then forcefully exhale through this mouthpiece and sustain the exhalation for at least 6 seconds. Okay, you can do. Exhale, keep exhaling, keep exhaling, 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 exhale, and you can stop. Stop. Okay, so when the subject is doing this, we are getting a graph here. So this is the first time he is doing. So I'm giving him some time and telling him to do it again. Okay, you do it again so that we'll see how it increases or not. Can you please do the test again? Keep exhaling. Can stop it. See, the exhalation has to be more stronger. Okay, the exhalation has to be more stronger. So you look at me how I am doing, and then sustain that, because I'm going to measure the forced expiratory volume in the first second and the forced vital capacity. Okay, so the both forced. So you have to give a forced thing when you do it, and then you sustain it for some time. So clear now? Good. Keep exhaling. Exhale. Exhale. And you can stop. Okay. So this is a good test. The third test he did was a very good test, and we'll see the interpretation. So to compare all the 3 tests, I'm selecting all the 3 tests and view test so that I can view all the 3 tests in this graph here. And if I want the data, click data so that all the data of all the 3 tests I can see here. Okay, so from this first test, I can interpret, so his forced vital capacity, forced expiratory volume in the first second, and peak expiratory flow rate. So depending upon his age, so the data, the software is giving a interpretation. So because we have entered the height and weight already, so based on that, the interpretation has come. So the third test he did was like the FEV1 FVC ratio is greater than 80%, so which is a normal thing. So when the FEV1 FVC ratio is less than 70%, it indicates that there is some obstructive lung disease. So his third test is really above 80%, so that's a good thing. So it clearly indicates his lung is in a good condition. So we'll go to the next test now. So one more test to show if there is any restrictive lung disease, like whether there is any chest wall deformity or any neuromuscular disorders are there, so which can restrict the lung. So we'll see about that also now. Okay, you can start doing. Inhale, very good. So can you look at the graph? Now we have got a curve in the lower portion also. So this is a flow volume curve actually. So flow volume curve. So this curve indicates if there is any obstructive lung disease, you can see while exhaling. And can you see a curve downwards which shows if there is any restrictive lung disease, you will not get this curve which is normal here. So there may be a concavity or a convexity in these 2 curves. So if there is any lung disease, so basically this indicates any problem if there is any obstructive, and this is for restrictive lung disease. So I'm saving this. So apart from this forced vital capacity, we have two more tests, that is slow vital capacity and MVV. So the slow vital SVC and MVV, slow vital capacity. So slow vital capacity, so it is a maximal amount of air exhaled in a relaxed manner after a deep inhalation. So it indicates if there is any problem, if there is any airway obstruction or if the forced vital capacity is reduced. So basically like 80 to 120% is predicted normal for this slow vital capacity. So the next test is MVV, that is maximum voluntary ventilation. So how much amount of air rapidly and deeply a patient can breathe for at least 12 seconds. So that will indicate if there is any problem. So the normal MVV is 140 to 180 liters per minute. So if there is any variation in this range, it can indicate obstructive or restrictive lung disease. And now he is performing the test. We'll start the test now. Slowly and deeply, slowly and deeply. Yes, you can maintain this and stop it. So it shows like for about 15 seconds how much breath he can take for maximum, voluntarily how much he can do it. So this is helpful while the patient is in ventilator and during the weaning process also. How much the patient is able to breathe by himself, synchronizing with the ventilator machine. So while for weaning protocol, this can be used. So this is about the MVV test. So if it is 140 to 180 is the predicted range, and if there is an increase or decrease indicates any obstructive or restrictive lung disease, or it is difficult for him to wean from the machine. We have also got the report for the test done now. So the students can look at the report and they can easily interpret the conditions. So what they theoretically learn, they are able to apply it here practically, and this will be very useful for them when they are working in the respiratory department, especially for the physiotherapy students. It's very useful and very informative to interpret the lung conditions, both pre-operative and post-operative also. So this is going to play a very major role in hospital setup. So, and we are happy and glad to tell that we have this equipment and students can learn their best from this.